And we're about it. Right. Good morning, everybody. We're sorry for the delay in this morning's meeting. The chair's going to call the meeting of the county commissioners to order. Commissioner Levitt is out of town due to important business. So first item on our agenda this morning is to approve minutes of the 31st and April 2nd meetings of this year. So I get a motion to approve.
So moved.
And then I will second that. Are there any changes you might wish to make? Commissioner face down to the minutes. All righty, then if I'm assuming you're in favor of adoption as myself. Okay, well, that vote is unanimous. Item number 2 is to approve the New Hampshire Superior Court lease amendment. Now, as many of you know, they're building a new district court in Rochester. And part of that is to move some of their operations out of this building when that building goes to be occupied. So there has to be an amendment to that, number one, and number two, an extension to the length of time that they will be leasing this space. So, Mr. Bard, do you want to address?
So I negotiated, and there'll be a 3% increase, which will start July 1st and be for the upstairs for 4 years at an additional 3% a year. And, for the probate court, it will last till they move. They're projecting, end of October, but honestly, they looked at me like it might more likely be November, but you know, cause you know how construction goes. And then besides the construction, they have to move.
Right.
And that might be some amount of undertaking if you've ever seen the amount of probate records.
Yeah.
You know, it'll be massive. So we certainly, I'm not really worried about the loss in revenue for the 1 month or so in remaining in this calendar year. But it's certainly something we'll have to adjust for in 2027.
Right. With the moving of probate court out of here, I have mixed emotions about that as it relates to the public. There's nothing I can do about it because it's controlled by the judicial branch. But I think the public, the courts have their reasons for doing what they're doing, but it's just going to inconvenience the public more. Because a lot of folks, when they're probating wills or documents or having family issues on different scales, they a lot of time property is involved in that. And they are able to walk across the hall now and register the properties as a result of what happens in the court hearing. Now they're gonna have to travel from Rochester down here when that goes to occur. And so there's gonna be some inconvenience by the public as a result of the judicial branch's decisions, which we don't have any control over. But I just wanted to say that for the record because it bothers me that the public is inconvenienced again.
I did have some, I did mention that, although the people that I, let's call it negotiated with, that's not their.
They don't care.
That's not their deal.
Right.
They're in a different state department that doesn't make those decisions. They're just handed those decisions and instructed to negotiate their, with the landlord on their way out. And I will tell you that Sarah Lineberry, who we've dealt with for I don't know, as long as I can remember. I apparently is passing the torch to another gentleman, so she's in the process of training him, and I'm confident that our amicable relationship will continue with this new gentleman.
Well, I think it's also on the flip side of that, the fact that we still have the Superior Court system here paying rent is a huge plus. And we've got and through that negotiation, Mr. Barr and I had discussed at length, we want to keep them here. We certainly don't want to raise our rent to the point where they can just go out and build another building. If that was to occur, I don't know what we would do with the space upstairs. It's pretty much.
And that would be a major inconvenience in terms of, because then we have probation and parole who pays rent, all of our drug court program, community corrections, the house of correction, everything. It would be a big movement far from this site would be, not only would we lose the revenue, but it would be a major expense.
right, to the county.
Deputy transportation,
Yeah,
you know, as another example.
and most of the counties in New Hampshire, the state has built good courthouses. And not involved the county at all. So when that occurs, as a matter of fact, since I've been here, Rockingham County has built 2 very new county courthouses. Since I've been here, 2. We would, so I'm glad that we're able to execute a 4-year agreement with them. At least that postpones that pain if it ever was to occur down the road some.
You know, and I negotiated as instructed, with that in mind.
Right, yeah. Okay, so unless you have any comments or questions, Commissioner, that's, okay, then, okay, we got a motion to approve, the lease amendment, with the state of New Hampshire. I will second that. Any further comments, Mr. Barrow?
No, sir.
Okay, all those in favor then, please handle myself as aye, and that vote is unanimous. We're gonna move on to approve the 2026 State of New Hampshire Adult Drug Court Program Grant. We have Carol Lee here. So, this is our continuation of our program, drug court program, which I am proud to point out for the record. We were the first adult drug court in the state of New Hampshire. We're in New Hampshire. When New Hampshire didn't even know what it was.
Yes, sir.
And now they fund it.
And now
Now
they
they
fund
fund
it,
it.
so kind of proud of that.
Can you give us some statistics?
Yeah, for sure. So last year we had 13 full completions in our program. If we're doing it right, success rate is 60%, and we're right in that number. As well as the state of New Hampshire does a really good job maintaining all the drug court programs. But Strafford in particular, we had the most pleas into our program last year. And that is comparison to Hills South, Hills North. So that's really good. We have a really well working team here with the county attorney and the pub's office, and I think that really helps the program. And we usually hover around 60 participants at a time, which is also a good steady number.
Well, that's a good success rate.
The other thing that I think citizenry doesn't think about, I mean, they think about recidivism. I don't think, I mean, that's a wonderful statistic and falls within the, you know, the higher part of the national average. But I think the important thing is what we're saving is victims. Because those people who recidivize, I don't even know if that's a word, but I'll give it my best shot, means that there is victims that are a consequence of that recidivism. And so yes, you know, everybody uses a statistic of recidivism. I prefer to use the statistic of saving victims.
Right.
Because that's what happens, because invariably there is a victim, whether it be the family, you know, in some cases, or usually by the time they're reaching drug court, it's beyond the family. The family's already been depleted in terms of, you know, they're just exhausted with this, and then it's turned into crimes in the general public. And sometimes, you know, now we take people who have committed some level of violent crime, which, remember, at the beginning, the feds wouldn't let us take as long as we were under their auspices, and now we're in a situation where because the state funds it. Yeah, it's a direct grant for the vast majority of the program. You know, we can expand who we're taking a little more than we could under the federal grant. And we could also take misdemeanors too, which wasn't allowable under the federal grant at the very beginning.
Yeah, we've certainly come a long way with the drug court program. And I can tell you that we're very, very proud of that. And I'm very supportive of the program. Number one, I know that the new commissioner is as well. But we have 2 new commissioners. We discussed at length, it's the dynamics behind it, the philosophy behind it. The other thing that folks don't realize is when we give these tools to the court, it gives the court another alternative besides
Absolutely.
besides
Yes.
jail.
Yep.
which we would all pay for. And any one of those programs that we have in alternative sensing has like a 4 to 10 to 1 savings to the property tax, which is that's a huge thing. Most folks don't understand that. Some people think we're being soft on crime. We're just not being soft. We're not being soft on crime. We're being smarter with crime, at least as far as I'm concerned. I hope that the public recognize that. So with that, Chair will accept the motion to approve the grant.
So moved.
Okay, and I'll second that. Any further discussion or comments?
No.
Thought it was a great job of writing it. Thank
Right.
you.
Thank you.
I read it all between yesterday and last night. I finished it up and Diane double checked numbers, made some adjustments and, mostly to allow for the increase that the county incurred for health insurance for the employees that are involved, because those adjustments are allowed. So Diane worked with Carol Lee, which is the first time that she's
Had to
authored
do
this
it.
on her own.
Yeah.
But she did a great job. I learned a few things when I was reading the grant application. She did a beautiful job with that. Thank you very much.
Yeah, thank you.
I know you spent a lot of time. It's a voluminous document.
It's fun. It is fun work.
Oh, boy. You think after a while, once these things get up and running, they would make things easier, but they just.
Yeah, still gotta piece it together,
Yeah,
so,
still gotta do it. Yeah. All right, well, thank you for everything. you've done
Thank you.
for us. As it relates to drug court, doing a good job down
thank you so much. I appreciate it.
Thank you.
Thank you.
there. All righty, item 4 is to recognize National Public Safety Telecommunications Week, which is April 12th through the 18th. Now, what are we supposed to be doing for that? We gotta buy everybody pizza or donuts, or what goes on? Why don't you, Sheriff, why don't you speak to me?
The options with you. We are next week celebrating that National Telecommunicators Dispatcher Week. Justin is the director of our excellent dispatchers. And they provide emergency services. They're that first point of contact for people and provide calm professional life-saving assistance in those first few minutes. We are requesting that you formally help us in recognizing them. We also give the opportunity to the towns that we dispatch for to recognize the dispatchers in any way they see fit, which last year they were very generous and supportive, which goes to show you how much they do appreciate it. We do hear from them, from the city, from the towns throughout the year, for compliments, for outstanding work often. But this week gives that opportunity for that formal recognition for each and every one of them. They're here 24 hours a day through all of the weather and tired and long shifts, and they're doing excellent work for the county. So
People really, when they call, they want to have a police officer, a firefighter, or emergency medical services, they really don't. It's so important that the dispatchers get the appropriate information, so it helps those officers that are responding. Without that critical information, they're kind of floating in the dark, and it's a stressful job. I know my brother did it for many years, and my sister-in-law was 40 years a dispatcher in Rockingham County. So I'm very familiar with what happens in a dispatch center. It's important for us to take the time to not only thank the operation, but thank them for their continued contribution to apprehension of criminals, for taking care of folks who are sick, with emergency services, the treatment of patients. There's just so much that dispatch centers do today that they didn't do years ago. I can remember in Dover, when I was growing up, Dover had 2 dispatch centers. We had a dispatch center for the fire department and one for the police department. And when there was a discussion by the city council to combine it, it was going to be, this horrible thing that was going to happen, and it shouldn't be that way. But I think that the present operation under Justin's lead, sheriff, has treated the firefighters and the emergency responders with the same respect that police departments have, and we're kind of we don't choose favorites, which is a good thing, because there's cultures that build up over time in police departments or fire departments that have a culture, and having to deal with so many different agencies. I just think you guys have done a wonderful job down there. We've appreciated trying to give you as much support as we can when it comes to equipment. We just spent $3.5 million upgrading our communication systems for the towns.
In 700,
Yeah,
granted, that Justin got for $700,000+ to enhance the
Right, from
radio
Rapids.
equipment for the cities, towns, and the sheriff's department.
Right, so, you guys have just done a great job, and, can't thank you enough for the work that you're doing down there. It makes Strafford County proud, and, I'll have the commissioners sign this proclamation, recognizing, Public Safety Telecommunications Week through from, April 2nd through October 18th. So I'm gonna move motion by Commissioner Feliciano to accept the proclamation. Okay, and I'll second it.
It's the April 12th though.
Yeah, April 12th, I'm sorry,
Sorry.
April 12th, 18th, yeah. Okay. So you're, I'm assuming we're both in favor of that, huh? I just wanna know when we're gonna get our share of the donuts, that's what I wanna know, okay?
Come on down.
Oh, the pizza, yeah. Well,
Thank you so much.
again, thanks for all the hard work you do. And if there's anybody at home listening, or tunes in our YouTube channel, I hope that they take a moment and thank a dispatcher, because they are really an intricate part of public safety that most of the time goes unrecognized.
We've coined them the first responders of Strafford County.
Yeah, there you go, right? It's true. All right, well, thank you. Anything else, Sheriff? You went for first responder?
No.
Everything all right downstairs?
Very
Okay. go for
Going
it.
along.
We'll get that down to the sheriff, okay, we would like Commissioner Lovett.
We'll have it signed. He'll be back Monday.
He'll be back Monday, we'll get it down to.
Thank you.
Thank you.
We'll do that. Okay. Thank you, Ray.
Have a nice day, guys. Take care, Chief.
Bye.
Okay, we've got some upcoming events. We've got the Willen Warming Center is holding a support fair on Monday, April 13th. Where a number of nonprofit agencies and service providers will be there on Monday to meet with clientele that's being serviced at the Willen Pond Center. Their contract, the present contract, ends April 15th. We're on budget so far. Haven't heard anything otherwise, although we've had a lot of cold weather. I think the present vendor has done an excellent job in running a very difficult operation too.
The other thing I think, Mr. Chairman, is that, as you know, the draft of the contract, came with, contributions from, I'm not talking about financial contributions, I'm talking about wording contributions from Dover, Somersworth, and
Right.
Rochester, and
Right.
and yourself, and it was an excellent job done at putting together a good contract that lays out the demands of the entity that runs it. And
our expectations, which.
and also protects us financially with, which is, I think, what you were referring to when you said it was on budget.
Right.
That's all done via a really solid job. I think. I've worked for you for almost 40 years. And I think you're really good at passing out praise to different entities. When the fact of it is, a lot of that is because of you. And I think you're the one that doesn't get the recognition. Not dissimilar to the dispatch situation. I wouldn't be here. I have over 50 years in the system. I wouldn't be here if it wasn't for you. And I don't think you get the recognition. In fact, a lot of times, if something is displeasing to certain members, you're the lightning rod for that.
Yeah.
And which is unfortunate, but I said my piece, I'm done.
Well, thank you, Ray, for that. The, there will be a report that, first of all, number one, I'll bring it up under old business, which has to do with Lillian Center. I want to get to these other two upcoming events, which are equally as important. There's a Strafford County Community Night, at the Delta Dental Stadium on May 17th. It's called the First Pitch Program, and anybody who, goes to that event, there's I don't know what you call these things. What do you call that?
There's a $5.
Yeah, it's a
for
$5.
every ticket that's
Right,
purchased,
we
would
get-
be the Fisher Cats,
Right.
$5 of which is
Right.
donated to Riverside.
To Riverside, right, the Memorial Fund.
So we're,
Yeah.
beginning to,
We're glad
pass
we're-
out that information
Yeah.
on a community-wide.
Right.
And facility-wide basis.
And the Fisher Cats, I've saw a few of their games. They're well, it was a lot of fun.
It's always fun, and it's a nice stadium too,
Yeah, it is.
you know,
It
for
is.
for minor league baseball, it's a really nice stadium.
Right. And we appreciate the opportunity for Riverside to be able to participate in that and get a few dollars out of it for Memorial.
From Memorial Fund, yeah.
Okay. So we get some old business and new business.
I have an old business,
Yeah.
Mr. Chairman, we just completed they say annual
So,
federal survey, state and federal survey at the nursing home. It's not an annual one, as you know, they can come 9 to 15 months, they're unannounced, and it's 9 to 15 months from the last time they were there. And, just to put it in perspective, Mr. Chairman, the average number of deficiencies on a federal basis is somewhere around 7. The average deficiencies on a state basis is around 5. And it's, you know, a little bit, it's never exact. It's like 4.75, something like that. We finished with 1, which will maintain our high star rating. And honestly, the deficiency is in regards to, we shifted to insulin pens for the distribution of insulin instead of needles. And it was, the proper amount of insulin was distributed. It was about priming the insulin pen. I mean, that's it. Out of five surveyors being there for 3 days, looking at every single thing we do. I tried to talk him out of the deficiency, but it didn't work because I said it was a med error and therefore falls under our med error rate, which is below the deficiency level, but they called it something else so that they could get us to deficiency for it, but that's okay. We were wrong. And we've since retrained that employee and made sure that all the other nurses we have a handy little handout, that was posted, but somehow just got missed. But you know what? I couldn't be prouder of the staff.
It's a very stressful time when surgery comes. I mean, everybody just is on edge and they're trying to do the best they can
And when a surveyor's standing there with you as you're doing med pass, you know,
somebody's looking over your shoulder saying,
they're
everything. you
standing
do.
right there watching you do every single thing, and it's stressful.
Yeah,
And they do several nurses, they observe med passes for several nurses. But, you know, they look at it's
They look at everything.
almost 800 pages of regulations that they are there to enforce.
That's
So,
amazing.
Yeah, and it's been a difficult year for a lot of places in terms of survey, so I'm real proud of that for us, or it's not really me. You know, it's the people that work at Riverside. I play just like a small part in that. The employees are the ones, I'm just the one that gets the deficiencies. Fortunately, none of them, we didn't have any repeat deficiencies, so.
Right,
Cause in the repeat now, they cite the administrator.
right.
Instead of the facility, so fortunately.
We didn't have any repeat.
Yeah, as I'm winding down, we got away with it.
That's
So
wonderful.
yeah,
Well,
I didn't get
congratulations.
that.
Congratulations.
Congratulations, yeah, I'm sorry?
Have you ever been
No,
cited?
never.
No.
I didn't wanna, but this is a relatively new regulation about directly citing the administrator. That primarily, I mean, there's other ways in which I could be cited, but the way that, the new part of it is a repeat deficiency, the administrator gets cited, as well as the facility. That's relatively new, just in the last couple of years.
Well, during survey, I had asked my colleagues not to call Ray over the last 3 days, because 3 or 4 days, because survey was there, and not to deal with, let him do what he has to do with the staff, because we're on the phone constantly.
It's stressful on the staff, I mean,
Yeah.
big time stressful. But
Yeah, it's a long 3 or 4 days.
plus there's, the feds just came out with a revision of the 800 pages last summer, and we used our primary part of our in-service budget to group watch a expert on going over the new regulations. So it's a lot cheaper than sending out, people to in-servicing. If we do it if we buy like a facility in service, it's a substantial savings. So we all got to watch this particular expert going over. It's not about the words, it's about the interpretation. And that's the key issue. So we're happy for that. We created a lot of really cool things and got some really great praise, even though survey is nothing but a negative process. In other words, they don't tell you what you do good. They just tell you what you do bad.
Right.
So.
Amazing job.
Yeah, great job for the staff. Well, I've got a couple of items of old and new business that I'd like to bring up for the record, if I may. As I'm sure most of you are aware, the county commissioners have been fielding a lot of phone calls and a lot of emails regarding the closure of Hyder. We've got a number of folks that are interested in pursuing the reopening of Hyder, which would be good news. And although I'm not able, the commissioner's not able to comment on it, I'm more than happy to report that I think something will happen as a result of these discussions. It's happening throughout the healthcare system. The folks that have been in touch with us, some of them are certainly capable of doing it, and some of them are not. But I wanted the public to know that we haven't given up on it, that the county commissioners haven't given up on it. We just had some financial realities that we're dealing with. That's number one. Number two, I met with the city of Dover officials over the past week to discuss the construction of the new warming center with our architect, with Hutter's architect, the construction company's architect. The plans have been submitted for the building permit process. The plan right now is to not have the city of Dover hold a public hearing. They are of the opinion that the city council held their public hearing and voted to bond the project. So they don't feel there's any further public hearing necessary. So we're trying to expedite that building permit process with the city so that Hutter can get started within a few weeks. That's the plan. So I wanted to put that out there for the record as well. So, any other old or new business do you have, Commissioner? Okay, alrighty. So questions or comments from the public regarding the agenda? Hey, good morning, Susan. I think it's still morning. Yeah, it's close as well. You have anything today you want to ask?
Well, I was gonna ask about Hyder and where we stood with that. And I also know that from the last meeting that Mr. Bauer had said something about redoing some of the rooms over
Yes.
Riverside. And is that still?
That's still,
We're still progressing so that there
Correct.
won't be that lapse, hopefully that lapse of service.
That's correct. and the hospitals have already called and said that they would step in as well. So
Okay.
they're all called. So I don't think there's gonna be a lack of service. The question becomes, it's just a different service. That's what it boils down to. It's just different. But I'm hopeful that, something will come along here shortly that'll allow Hyder to reopen. It's just, it's as we have stated in the past, the ever revolving, ever changing healthcare environment is changing, right? It's changing every day. The reimbursement schedules are changing. We've got hospitals buying hospitals. You've got so many things that are going on in that system. It's really mind-boggling to even try to keep track of the different dynamics that are going on. Like, for instance, what happened with Frisbee when they wouldn't do any more, they closed down their birthing center as an example. Everybody had to go to Wentworth or
Portsmouth
or Portsmouth or York or somewhere else because Frisbee wouldn't provide the service. You have that going on throughout the healthcare system. And I think it's important for us to point that out. And Hyder is not, and the county, frankly, with our nursing home operations, we're not insulated from that. And we're the only county that runs a hospice house. And frankly, for the record as well, if it wasn't for Ray Bauer and my efforts back 20 years ago, there wouldn't be a hospice house.
Oh,
There
and the
wouldn't
delegations vote.
And the delegation voted.
Voted unanimously
Right.
for us to run it.
For us to run it. It just, things have changed since then. It's just changed. There's nothing we can do about the change. You know?
So what is the likelihood of the employees of Hyder? I know that you're trying to incorporate whatever you can into Riverside, but obviously there's going to be some job loss. Is there any way, or are you thinking about negotiating that those employees would be able to fall under this new I'm gonna call it management, because I don't think it's ownership at this point.
No, it's not ownership.
But it's management. And does that look like a prospect as a negotiating?
Absolutely. As well as, we can use one or two at Riverside, even, you know, and the aides, I put a freeze on the hiring of aides, you know, since January 1st. And so we have not hired any nurses aides, and we have, it's about approximately 75 full-time equivalents of nurses aides. And typically, and this, please don't confuse this with me making any comments about gender. They're historically young ladies, who, you know, might move on to something else, might be in nursing school and, you know, leave. And so, because we haven't hired anybody, we can assume the aides there. So that works out. It's the RNs, because they're all RNs. Two RNs are going to the House of Correction because we needed nurses there.
You had mentioned that.
Yeah, and two are gonna come to Riverside. Some have
Already been hired by other.
they've been already hired by hospice because they don't, you know, they want to stay with the hospice principle. So the area hospices have benefited from that. And we're waiting, tomorrow's kind of the deadline. We put the 10th as the deadline to tell us if you want to come to Riverside, if you want us to figure that out. So we're still awaiting the answer from several, a handful. The majority have either found other jobs and given us their notice and or are going to the House of Correction.
Incorporated within the
Yeah,
county.
we're almost there. You know, there's just a few.
Yeah, there was one that was thought about retiring too, so there's.
Yeah, there's one that's probably gonna retire.
Retire.
She actually told us she was gonna retire at the end of this year anyway.
Right.
You might just do it a little sooner.
So, you know, you have that mix.
I have a second question, because you had alluded to the fact that there could be a problem with ICE, and we always had people coming and going and the income for that. Where do we stand with that? Are they continuing to pull out? Are we still?
Well,
Well,
it's.
I can, yeah, the only reason I'm saying that is Chris had to leave he's doing a tour that you started this morning.
Right,
He's
right.
doing a tour at the House of Correction. Since the delegation meeting at the beginning of March, you know, everybody reads the newspapers, everybody watches the videos. We were on track for January and February, remembering that you expect a 10% decrease in February because it's only 28 days. You know, you know, so there's 3 days, approximately 3 days less. So I actually track it by the day because that's how we're reimbursed. And we're about $100,000 behind in all of which happened in March. We've had communications with ICE, but we can't seem to quite get to the level of the big decision makers. So we're working on that. You know, I can't tell you exactly why, but we're working on it to hopefully bounce back from that. But problem is that you can't wait. Because you can't wait till you get far behind and
Right.
then try and make
Try to
up.
make it up, you can't make it up.
And that's why I think that I recommended to the commissioners about Hyder. But I am, you know, pleased that we've reached out. We've been
reaching out to everybody and anybody.
and they've been reaching out back.
Right.
And
talking.
I'm more optimistic than ever.
Well,
And it won't involve any county money.
you seem much more at ease at this meeting, George, and a little more optimistic.
And that's because
than-
we've had
Because
communication.
you've had
Right.
I
communication,
call it negotiation.
negotiations,
Yeah.
communications,
Yeah.
there's dialogue that's happening.
It is, and, you know, for anybody to think that the commissioners did want to do this is just insane. I mean, as I said earlier, they wouldn't, we're the only county that runs a hospice house. No other county runs a hospice house in New England, okay? The reason why we ended up running it was that we were in a default position because the three
The
agencies,
three agencies before that.
they lost millions and millions of dollars, and that's a reality. You know, people, it's interesting, people were very happy with the service that were provided there, but they have absolutely no idea of how it's paid for or the cost associated with operating it. And when the delegation basically, you know, they weren't too kind. I mean, they were pretty specific. They were upset
Let's
about.
face it, they were brutal.
Yeah, they were brutal, right. And they-
Unexpectedly.
unexpectedly saying no. You know, okay, we get that, but there are consequences to that action. That there are financial consequences to that action. We would be totally irresponsible if we just sat back and said, okay, first of all, you can't.
We have a contract.
We have contracts, and the other thing too is that it's just, it's very personal for Ray and I. You know, the hospice house was a very personal thing for him and I. And to see it happen, because Seacoast Hospice in its infancy didn't have any place to go. They wanted to locate in Portsmouth. We actually offered them the land here for free. And we weren't even on the radar.
No, they didn't even, at first they thought they couldn't get funding, what they called the other side of the bridge. Yeah, meaning the Portsmouth
Yeah,
Bridge.
that's
And
a
so,
mental barrier,
Right, it
It
is.
happens all the time. They
It
don't
is,
wanna
it's
go
the
over the
bridge.
bridge. I don't understand.
Yeah, and when we went there, both Ray and I received an award from Seacoast Hospice for trying to think out of the box. And that's what we did, and the thinking out of the box worked for many years. It's just the healthcare system has changed. And I don't think people, and I'm gonna keep saying this until it's a broken record. The healthcare system, the dynamics of it and its funding has all changed. And it's gonna continue to change. And as those changes happen, if we were a $600 million operation or $1 billion operation, we wouldn't be discussing it. It would be something that we would absorb in our operating. But we're not that big an operation to be able to absorb those kinds of losses year after year after year without raising folks' taxes. And I think people are tired of that. They voted for caps for a reason. And so something has to give. And it should, in most cases, it's the thing that loses the most money. In this particular case, it's Hyder. And you know, I'm hopeful that some other bigger player can step in that's bigger than us to be able to do it. because, that type of care is really important. Palliative care, it didn't even exist 20 years ago, you know?
Didn't exist when my mother passed.
Yeah, it didn't exist when my dad passed. It didn't exist.
I think we've all had touch points in our lives of people that
Yeah.
have had to go through that.
Yeah.
And end of life care is end of life care.
Yeah, that's what it is. And I've had so many friends and family members pass away there. They think that, you know, they don't think we're all human beings. We are. We all have those experiences with parents, with loved ones, with friends. I can't begin to tell you how many friends I have and I had that passed away. And I
Okay,
went,
so can we just do a positive?
yeah, the positive is we're working. The
No, the
positive.
positive is you still gonna have your golf tournament this year?
Oh,
Absolutely.
yeah. Oh, yeah.
That's
That's for sure.
100% so.
Oh, yeah.
Yeah,
There are a lot of positives. You know, Strafford County has a lot of positives. We have
Well,
a ton more positives.
every once in a while, bring up something positive, because you can't always have that mindset of all the bad and all the negative.
I don't think you
So-
can get any more positive than our survey results. I mean,
Right.
that-
Well, that's a positive thing, but something,
But
just
that
trying
is,
to end it with something.
Sure.
those survey results, are amazing.
Yeah.
And, you know, I'll be honest with you, I was happy with the one minor deficiency that we got, and there might be grounds for me to contest it. I have no issue with that. Thank you for the deficiency.
Right.
See you next
See you
year,
next year.
or see you between 9 and 15 months. I'm all good, and it was a wonderful team. And every time they come, it's like our inspections at the House of Correction. Every time they come, we learn something.
Right.
And it's the same thing with our relationship with ICE.
Yeah.
You know, people think
Right.
ICE has made us a better jail. I've said that 1,000 times.
Yeah, it has.
And because the requirements that they have, no one else in New Hampshire does, except us. And I can't tell you that we would have done those if it wasn't for our relationship with ICE.
Right. Right. It's just another set of eyes.
Well,
It's always good to have
and
another
it's,
set of.
it's regulations that have become issues in other parts of the country.
Right.
That they're incorporating in their rules, even though we might not have seen those violations in our operation. They bring a nationwide perspective to make us a better jail.
Right.
And the irony of it is, this prior delegation is the one that voted $800,000 to split Unit C,
Right.
so we could take the low security.
Yeah, yeah.
Sometimes those history pieces don't
They
go
don't
on
fit.
to the next delegation,
That's right.
and
Or they
that's
don't.
why when I get you talking.
Right, they don't
We
care.
get the history
Right.
Yeah.
and to
Right.
get it out there.
Yeah.
It's-
Well, I appreciate that too,
Yeah.
Susan, when you do that. I
Yeah.
know we got some folks joining us.
No, they're all
They're staff. Okay.
Yeah, they're mine.
I see one that says guest, so I don't know.
I don't know who that is, but it's probably,
One of yours, okay.
they're waiting and,
Okay. All right.
they're actually waiting for me to tell them to come over, but we've got a couple
Yeah.
other things to do.
Right.
But
Okay.
it's some,
Yeah, I know,
it's
because we're-
part of the negotiations that we're dealing with.
Okay. Are you all set for now, Susan, or anybody else,
Well,
Brian?
next week and I'll have a few more.
I hope
We'll
so.
just keep going at it.
Keep coming at it.
Keep coming at it. Okay, I got a motion to move into non-public session then for personnel and contract negotiations.
Someone,
And I'll second that. We'll call Commissioner Feliciano.
right?
Myself, yes, that motion is unanimous, so the commission will retire to non-public session. Thank you all. Appreciate it.